Hi everybody. Schizophrenia and supporting someone that has the illness. First of all, excuse me. Schizophrenia is one I would say of the more severe ones out of the mental health conditions. As two component like the positives and the negatives. The positives are the added that's symptoms of schizophrenia. Now, everybody, many people, it affects them differently. Their symptoms with the schizophrenia, they is affected by the symptoms affect them differently. Not everybody is the same of how it affects them. Some people will hear voices, some may not with schizophrenia, some may just have the thoughts, the negative, horrible thoughts. Some may hallucinate as well. They hallucinate with schizophrenia, like seeing and hearing things that nobody else can see or hear. Now, like I said, it's a serious illness. There are treatments for schizophrenia. Many times before, many people, it was thought that schizophrenia couldn't be treated. They said that schizophrenia in itself, a lifelong experience, when I think that's a little bit untrue, because many people with the right treatments have got through the other end and their symptoms have gone. That's with some, but some people, they've got through the other end and being able to cope better with their illness and get on with their day-to-day tasks as well. So that's the journey with schizophrenia. Everybody's journey is different. Like I said, some will pull right out, full recovery with no symptoms, and some people come through and be able to cope, maintain their illness. Their symptoms may alleviate a bit better and be able to live a near to normal life and to start to cope with tasks that they couldn't do before. So supporting somebody that has schizophrenia, remembering first of all, schizophrenia is an illness, it's not the person. Schizophrenia is not that person. It's the illness. So how it's affecting them and their behaviours and whatever the symptoms are, it's the illness. And plus as well, not to take things personally, because sometimes with what's going on with them, how their symptoms are affecting them, their behaviours, it may feel like it's going towards yourself, but it's not. It's how they're trying. That you've got to remember that fighting the illness takes strength. So it's not a sign of weakness; it's a sign of strength. So their behaviours that it may seem like when they're going towards towards you, and some people may take it personally, but it's not. It's the illness, it's the schizophrenia, it's the symptoms that are doing it. It's how it's affecting them. It's very complex. It's very complex because it takes a lot of understanding around it. And that's another thing as well. Understanding what that person is going through that you're supporting. Understanding their symptoms of how it's affecting them. Like, it takes, for them to sort of like just say what's going on in their head, like with the voices, it's very difficult for them at first to say it. You know, it's not something that just comes out in conversation, because the thing with schizophrenia is the reality side of it, the disconnecting from, socially disconnecting is the false reality, is disconnecting from other people. So that's the reality side of things. Their experiences of hearing voices, hallucinating, or the thoughts, just the thoughts, is their experiences, and that is their reality. So it's understanding that is what their reality is, the disconnection from, socially disconnected from other people, the world, and their reality is their inner, their inner. So their voices, that's their reality, not people in general. They disconnect from the world in a sense of, it's very hard to explain. I can explain it the best way I can, but at the same time, never to disbelieve someone that you're supporting, never to say to a person, if they're telling you that they're hearing voices in their head, never say to someone with schizophrenia that isn't really happening. It's not really happening, because to them, that's their experience, what they're experiencing, and that is their reality. So by saying something like that is disrespectful, really, to what they're experiencing, because to them, that is what's going on. That is what they're experiencing. So in some sense, you can't really say that isn't going on. It's the symptoms of the schizophrenia, is how it's affecting them. So that's what you've got to remember. So if you're talking to someone and they're saying something like that, is talking to them, how to talk to someone that is suffering with schizophrenia. Once they get your trust, and your trust, because trust is a big thing as well, because the suspiciousness of everything, and the behaviours, how it affects the behaviours. So it's building on that trust, and they will eventually see that they can trust you. They can trust you, and to open up to you a bit more. Learning to talk about their illness at first is a big thing. It's not something that is going to come natural. With the right therapies, the treatments, the therapies, like the talking therapies, CBT, psychotherapy, it needs good treatment there, and with good treatment, it will enable that person to give them that ability to get a bit of understanding of their illness, of how it's affecting them, their symptoms, and to be able to start to manage it a bit better. So eventually it helps them to talk a bit more about their illness. They might not talk straight away. Like I said, socially disconnected from other people. That's one of the things with schizophrenia. But eventually, with the right treatments, the balance comes in. Being able to get a balance there, so being able to open up a bit with that trust from that other person. So, talking to someone that you're supporting that is suffering with schizophrenia, when they're explaining those sort of things, when they're talking about what's going on with them, that when they're in them moments of despair, is talking to them about that as well. Talking to them about what is going on with them, like asking them about their experiences, so it enables them to talk it out, and to be a bit more confident, because you've got to remember there's been a lot of stigma with schizophrenia. There's been a lot of stigma around mental health, but with schizophrenia, it's been left in the shadows. It was left in the shadows, pushed to one side, gradually starting to come out a bit more in the open. So people that are suffering with schizophrenia, with the stigma around it, it doesn't help them. And remembering as well, don't listen to everything you hear about like schizophrenia, with the misconceptions around it, that they're violent people, they go out and be violent towards other people. That is a small minority, maybe 2%, if that it may have happened to. A lot of the time, most of the time, you got to remember, they're vulnerable, they're suffering, they're in pain and they're suffering, trying to fight a serious illness. They become vulnerable. A lot of the time, they become the victims of something. So they're vulnerable, but remember, they're not. It's not weak. The illness is not a sign of weakness. It's a sign of strength, because they're battling that. They're battling that illness, and with strength, that needs strength there. So just being there and being supportive towards somebody that is suffering with schizophrenia, and basically as well encouraging them, giving them that hope, giving them a bit of hope to hold on to, that it doesn't have to be like that for the rest of their life, giving them the encouragement to do things like hobbies, doing something for their self, giving them the choices that what they want to do, just being supportive there, because it is possible to do. Like I said, there are treatments. Obviously the first line of treatments is medication. Now with medication, a lot of people say that with schizophrenia, the only thing that's going to help them is the medication, which is not. Medication is just there to help with those symptoms, to try and get a balance there. It needs other things alongside it, other treatments, learning and coping strategies to be socially connected again. It is possible to do, but it's a long journey. It may be a long journey, but being there and being supportive to someone that has schizophrenia is all about giving them some hope to hold on to, giving them some encouragement to eventually self-help care, doing things that is going to help them more. It's going to help them have less relapses, because the recovery as well is about eliminating those relapses. Those relapses are bad moments, like psychotic episodes, like where somebody may have to go into hospital from time to time. But eventually, along the line, that doesn't have to be a lifelong thing where someone is going in and out of hospital and having really bad episodes. Eventually, like I said, with the right treatment, the right support there, and supporting them in the right way, giving them hope, giving them encouragement, the chances are those relapses will get less and less, and be able to manage a bit better And it, like I said, it is possible to do. Me, myself, I support my partner. He has schizophrenia, so that's what I've been doing since we've been together. I will say, you know, I'm not going to lie, it can be hard, it can be tough, but you've got to think about it. It's tough for that person as well that is suffering with the illness. You've got to think what they're going through, what their experiences are, how it's affecting them. But like I said, it is possible to pull away from those less psychotic episodes with schizophrenia with the encouragement and hope there. Like I said, I support my partner. I'm there for him. I've got that understanding around it. The understanding, a bit of acknowledgement around it, is knowing how it affects him, like the triggers. I know myself, his triggers, you know, I know it myself. Plus as well, he's also coming through the other end. Got to a stage where done the therapies, he's on a low minimum dose. I won't go too much into it because that may be for another video, but what I'm saying is he's doing really well. He's got to a stage where being in a bad moment, being in those really bad moments, like scales, 8s, 9s, at one point he could be in them for months in that situation, but now he can come out of it quicker, and sometimes within an hour he's come out of it. Me myself, I've calmed him down, I've talked him through the bad moments that he's been in, and it's calmed him down. You know, it is difficult. You just got to have that understanding there and be supportive towards that person and let them know that they're in a safe place, they feel safe, because a lot of the time the illness, fearing that illness, fearing of being out of control with the illness, how the illness makes them feel, letting them know that when they're in those moments, letting them know that it's safe, letting them know they're in a safe place. There is a lot to it, you know, supporting somebody with schizophrenia, but you've got to be committed to it, understanding that person and seeing that person as a person and not as schizophrenia. Schizophrenia is just a diagnosis. It's an illness like any other illness, so we shouldn't look at that person when they're having those difficulties is that's who they are. They're not. They are a person. That is just the schizophrenia. That is just the diagnosis. It's not them. So this video was about supporting somebody with schizophrenia. Like I said, it's hard, but it can be done. I've been doing it now. Me and my partner, we've been together now probably nearly 6 years. Yeah, 5.5, nearly 6 years. And I've stuck by him and I've supported him through it, through the bad times. But I will say as well, if you're supporting somebody with schizophrenia or any other mental health problem, it is tough on your well-being. It can be. So I would suggest having something, making sure that your well-being stays good by having something for yourself that you can do for yourself to help with any stressful moments, like a hobby, anything like that. Having something that you can call for yourself, that you can do for yourself. Like I do Qigong. I do Qigong every morning. It's very good. I've explained it in my other videos, so that helps me each day. My walks, we both go out for walks together. I do these videos. I feel doing these videos for mental health helps me in a sense. That helps with my well-being, because I feel if any of my videos can help somebody, you know, or some people, that's just good, you know, it make me feel good within myself that what I've done, I've achieved something by helping somebody, really. So yeah, make sure when you're supporting someone with mental health, you've got something in place for yourself that you can call for yourself, what you do yourself to help with your well-being. Because if your well-being goes down a little bit, then you won't be really much help to that person that you're supporting. So keeping in check with your own well-being as well. So yeah, so anybody out there that is suffering with schizophrenia, hold on to that hope. There is treatment out there. You will get to a better place where you feel that it's good for you, and be able to start to enjoy your life again and cope with things a lot easier as well as time goes on. So I'm going to end the video there. Please share this video because it's very important. Our mental health is just as important as our physical health, and it should be kept into the open a bit more about mental health, not in the shadows, not pushed to one side. So please share this video and don't forget to give us a like, and see you in the next video.